Hello everyone, and welcome back to a Vital Nursing 101 video. Today we are going to talk about topical pain medications, specifically lidocaine and diclofenac. These are medications that are applied to the skin to help with pain in a specific area. You may see lidocaine patches, lidocaine creams, lidocaine gels, diclofenac gel, diclofenac topical solution, or other topical forms depending on the setting. At first, topical pain medications may seem simple, because they are not swallowed like pills and they are not injected like IV medications. But they still require careful nursing judgment. Topical does not always mean harmless. Topical medications can still cause side effects. They can still be absorbed into the body. They can still interact with other medications. And if they are applied incorrectly, used on broken skin, covered with heat, or used in excessive amounts, they can become unsafe. So in this video, we are going to break down lidocaine and diclofenac step by step. We will talk about why they are used, how they work, important side effects, major warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will include pop test questions to help you think like a nurse. Let's start with the basics. Topical pain medications are applied directly to the skin. The goal is to provide pain relief in a specific area, instead of affecting the whole body as much as an oral or IV medication might. A simple memory tip is, topical means targeted. Topical pain medications are often used when pain is localized. Localized means the pain is in one area. For example, a patient may use a lidocaine patch for nerve pain after shingles. A patient may use diclofenac gel for osteoarthritis pain in the knee or hand. A patient may use lidocaine cream before a minor procedure to numb the skin. A patient may use diclofenac topical solution for joint pain. The benefit of topical pain medication is that it may reduce the need for oral medications in some patients. For example, a patient with knee osteoarthritis may not be a great candidate for oral NSAIDs because of stomach bleeding risk or kidney concerns. Depending on the patient and provider plan, topical diclofenac may be considered because it targets the joint area more locally. But remember, topical does not mean zero risk. Pop test question. What does topical mean? A. Applied to the skin. B. Injected into a vein. C. Taken only by mouth. D. Given through a feeding tube. The correct answer is A. Topical medications are applied to the skin or surface area. Now let's talk about lidocaine. Lidocaine is a local anesthetic. Local means it works in one area. Anesthetic means it numbs sensation. Lidocaine helps reduce pain by blocking sodium channels in nerves. Sodium channels help nerves send signals. When lidocaine blocks these channels, the nerve has a harder time sending pain messages. A simple way to think about it is, lidocaine quiets the pain signal. Memory tip: lidocaine locks the line. The nerve is trying to send a pain message, but lidocaine helps block that signal line. Lidocaine can come in different forms. There are lidocaine patches, creams, gels, sprays, ointments, and solutions. In nursing practice, you may commonly see lidocaine patches for localized nerve pain or musculoskeletal pain. You may also see lidocaine cream used before needle sticks, IV starts, or minor procedures. Lidocaine is not an NSAID. It does not reduce inflammation like diclofenac. It does not work like an opioid. It does not treat infection. It numbs the area by decreasing nerve signaling. Pop test question. Lidocaine works mainly by blocking what in nerves? A. Sodium channels. B. Blood sugar receptors. C. Platelets. D. Bacteria. The correct answer is A. Lidocaine blocks sodium channels, which decreases nerve pain signaling. Now let's talk about why lidocaine is used. Lidocaine topical products may be used for localized pain, especially nerve-related pain. For example, after shingles, some patients develop postherpetic neuralgia. Postherpetic neuralgia is nerve pain that remains after a shingles rash heals. A patient may say, "The rash is gone, but my skin still burns and hurts when clothing touches it." That burning, sensitive nerve pain may be treated with a lidocaine patch. Lidocaine patches may also be used in some settings for localized musculoskeletal pain, such as back pain, depending on the provider's order and facility policy. Lidocaine cream may be used before procedures to reduce pain from needle sticks or minor skin procedures. The key nursing concept is that lidocaine works locally, so it should be placed where the pain is, if the skin is appropriate for application. Do not place it randomly. Do not place it on broken, infected, irritated, or open skin unless specifically ordered and appropriate for that product. Why? Because damaged skin can absorb more medication, which may increase the risk of systemic side effects. Systemic means throughout the body. Pop test question. A patient has a lidocaine patch ordered for localized nerve pain. Where should the nurse apply it? A. Over the painful area if the skin is intact and appropriate. B. On any random area of the body. C. Over an open wound without checking the order. D. Inside the mouth. The correct answer is A. Lidocaine patches should be applied to the painful area on intact skin, following product instructions and provider orders. Now let's talk about diclofenac. Diclofenac is an NSAID. NSAID stands for non-steroidal anti-inflammatory drug. NSAIDs help reduce pain, fever, and inflammation. Topical diclofenac is applied to the skin to treat pain in a specific area, often joint pain. You may know topical diclofenac by brand names such as Voltaren gel or Pensed solution. Diclofenac works by blocking COX enzymes. COX enzymes help make prostaglandins. Prostaglandins are chemical messengers involved in pain and inflammation. So when diclofenac decreases prostaglandins, inflammation and pain can decrease. A simple memory tip is, diclofenac decreases discomfort by decreasing inflammation. Topical diclofenac is commonly used for osteoarthritis pain, especially in joints such as the hands, knees, elbows, ankles, or feet, depending on the product instructions. Osteoarthritis is a joint condition where cartilage breaks down over time, causing pain, stiffness, and decreased function. Topical diclofenac may help reduce joint pain so the patient can move more comfortably. But diclofenac is still an NSAID. That means we still think about NSAID warnings: GI bleeding, kidney risk, cardiovascular risk, blood pressure, fluid retention, and bleeding risk. The risk may be lower than oral NSAIDs for some patients because less medication usually reaches the bloodstream, but the risk is not zero. Pop test question. Diclofenac belongs to which medication class? A. NSAID. B. Opioid. C. Antibiotic. D. Antihistamine. The correct answer is A. Diclofenac is an NSAID, even when used topically. Now let's compare lidocaine and diclofenac. Lidocaine is a local anesthetic. Diclofenac is an NSAID. Lidocaine helps numb pain by blocking nerve signals. Diclofenac helps reduce pain and inflammation by decreasing prostaglandins. Lidocaine is useful when the goal is local numbing or reducing nerve pain signals. Diclofenac is useful when the pain is related to inflammation, especially joint pain from osteoarthritis. Lidocaine's major safety concern is local skin irritation and systemic toxicity if too much is absorbed. Diclofenac's major safety concern is local skin irritation, plus NSAID-related risks, like GI bleeding, kidney injury, cardiovascular events, and bleeding risk. Memory tip. Lidocaine numbs. Diclofenac calms inflammation. Pop test question. Which statement is correct? A. Lidocaine and diclofenac work the exact same way. B. Lidocaine numbs nerve signals, while diclofenac reduces inflammation as an NSAID. C. Diclofenac is an opioid. D. Lidocaine is a steroid. The correct answer is B. Lidocaine and diclofenac are both topical pain options, but they work differently. Now let's talk about side effects of topical lidocaine. The most common side effects are local skin reactions. The patient may have redness, irritation, burning, itching, swelling, or rash at the application site. Some mild irritation may happen, but severe or worsening skin reactions should be reported. Now let's talk about lidocaine toxicity. This is less common with correct topical use, but it is very important for nursing students to know. If too much lidocaine is absorbed into the bloodstream, it can affect the nervous system and the heart. Risk increases if the patient uses too much, applies it too often, uses it over a large area, applies it to broken or irritated skin, uses heat over the area, or leaves patches on too long. Symptoms of lidocaine toxicity may include dizziness, confusion, nervousness, drowsiness, ringing in the ears, blurred or double vision, metallic taste, numbness around the mouth, twitching, tremors, seizures, slow heartbeat, abnormal heart rhythm, low blood pressure, loss of consciousness, or cardiac arrest in severe cases. This is why topical lidocaine has strict instructions. For example, lidocaine patches are usually worn for a limited amount of time and then removed. A common instruction for prescription lidocaine 5% patches is to apply up to 12 hours within a 24-hour period, but always follow the specific order and product instructions. Do not leave the patch on all day unless that is specifically allowed by the product. Pop test question. Which finding may suggest lidocaine toxicity? A. Ringing in the ears and confusion. B. Improved appetite. C. Increased hair growth. D. Mild thirst after exercise. The correct answer is A. Ringing in the ears, confusion, dizziness, tremors, seizures, or cardiac symptoms may suggest lidocaine toxicity. Now let's talk about heat and lidocaine patches. This is a huge patient teaching point. Do not apply heat over a lidocaine patch unless specifically directed by the product instructions or provider. Heat can increase absorption through the skin. That means more medication can enter the bloodstream. More absorption can increase the risk of serious side effects or overdose. Patients should avoid heating pads, electric blankets, heat lamps, hot tubs, saunas, tanning lamps, or prolonged sun exposure over the patch area unless the product instructions specifically allow it. Also avoid tight coverings over the patch unless instructed. Covering an area too tightly can sometimes increase heat and absorption. Memory tip: heat helps lidocaine hurry into the body, and that is not what we want. Pop test question. Why should patients avoid placing a heating pad over a lidocaine patch? A. Heat can increase lidocaine absorption and toxicity risk. B. Heat makes the medication stop working completely. C. Heat turns lidocaine into an antibiotic. D. Heat prevents skin irritation. The correct answer is A. Heat can increase absorption of lidocaine and raise the risk of systemic toxicity. Now let's talk about side effects of topical diclofenac. The most common side effects are local skin reactions. These may include dryness, redness, itching, rash, scaling, peeling, irritation, or burning at the application site. Diclofenac can also make the skin more sensitive to sunlight. Patients may need to protect the treated area from sunlight and tanning beds. But because diclofenac is an NSAID, we must also think about systemic NSAID side effects. Even topical diclofenac can carry warnings for serious cardiovascular and gastrointestinal events. Cardiovascular events include heart attack and stroke. GI events include stomach ulcers, bleeding, and perforation. Perforation means a hole in the stomach or intestine. These risks may be higher in older adults, patients with heart disease, patients with high blood pressure, patients taking anticoagulants, patients with a history of ulcers or GI bleeding, patients using other NSAIDs, and patients who smoke or drink alcohol regularly. Topical diclofenac can also affect kidney function, increase blood pressure, worsen fluid retention, and increase bleeding risk in some patients. Again, the systemic exposure is usually lower than with oral diclofenac, but the risk is still important. Pop test question. A patient using topical diclofenac reports black tarry stools. What should the nurse do? A. Report it because it may indicate GI bleeding. B. Tell the patient to apply more gel. C. Document it as normal. D. Ignore it because diclofenac is topical. The correct answer is A. Topical diclofenac is still an NSAID and can be associated with GI bleeding. Now let's talk about black box warnings and major warnings. Lidocaine topical products do not have the same NSAID boxed warning that diclofenac has, but lidocaine has serious toxicity warnings if used incorrectly. Major lidocaine warnings include excessive absorption, toxicity, seizures, heart rhythm problems, and serious reactions when used on damaged skin or with heat. Lidocaine should be used exactly as directed. Do not apply extra patches. Do not leave patches on longer than ordered. Do not place on broken skin. Do not use external heat over the patch. Diclofenac topical products carry NSAID warnings. NSAIDs may increase the risk of serious cardiovascular thrombotic events, such as heart attack and stroke. These events can be fatal. NSAIDs may also increase the risk of serious gastrointestinal bleeding, ulceration, and perforation. These can happen without warning and can be fatal. Diclofenac should not be used around coronary artery bypass graft surgery, also called KBG. Diclofenac can also cause serious skin reactions, allergic reactions, kidney injury, liver injury, fluid retention, and blood pressure elevation. This sounds intense, but it is the reality of NSAID safety. As nurses, we teach patients that topical diclofenac can be safer for some people than oral NSAIDs, but it is still a real medication with real warnings. Pop test question. Which topical medication still carries NSAID cardiovascular and GI bleeding warnings? A. Diclofenac. B. Lidocaine. C. Normal saline. D. Petroleum jelly. The correct answer is A. Diclofenac is an NSAID and still carries NSAID warnings even when applied topically. Now let's discuss nursing responsibilities before applying topical lidocaine. First, verify the order. Check the medication, dose, route, site, frequency, and duration. Second, assess the reason for use. Is it nerve pain, localized pain, procedure-related numbing? Third, assess the skin. This is very important. The skin should be clean, dry, and intact unless a specific product is designed for a different use and the provider ordered it. Do not apply a lidocaine patch to open wounds, cuts, burns, infected skin, or irritated skin unless specifically ordered. Fourth, assess allergies. Ask about allergy to lidocaine or other local anesthetics. Fifth, assess current symptoms. Does the patient already have dizziness, confusion, tremors, seizures, ringing in the ears, or irregular heartbeat? These symptoms matter because they could worsen or suggest toxicity if lidocaine is being overused. Sixth, review the medication administration record. How many patches are already on the patient? When were they applied? When should they be removed? This is a common nursing safety issue. A patient may have an old patch still on the body. Always check for existing patches before applying a new one. Seventh, label or document the patch according to facility policy. Some facilities require the date, time, and initials on the patch or dressing. Eighth, wash hands after application and avoid touching eyes or mucous membranes. Pop test question. Before applying a lidocaine patch, what should the nurse check? A. Skin integrity and whether an old patch is still in place. B. Patient's favorite color. C. Shoe size. D. Hair length. The correct answer is A. The nurse should assess skin integrity and make sure old patches are removed as ordered. Now let's discuss nursing responsibilities before applying topical diclofenac. First, verify the order and product instructions. Different diclofenac products may have different dosing and application instructions. Second, assess the pain location and type. Is the pain from osteoarthritis? Is it a joint? Is the medication being applied to the correct area? Third, assess the skin. Do not apply diclofenac to open wounds, infected areas, rashes, or damaged skin unless the product and provider specifically allow it. Fourth, assess allergies. Ask about allergy to diclofenac, aspirin, ibuprofen, naproxen, ketorolac, or other NSAIDs. Ask about asthma attacks, hives, or breathing problems after taking NSAIDs. Fifth, assess bleeding risk. Ask about history of stomach ulcers, GI bleeding, easy bruising, anticoagulant use, antiplatelet use, steroid use, or heavy alcohol use. Sixth, assess cardiovascular history. Ask about heart disease, heart attack, stroke, high blood pressure, heart failure, edema, or kidney disease. Seventh, review medications. Look for warfarin, heparin, enoxaparin, apixaban, rivaroxaban, clopidogrel, aspirin, other NSAIDs, steroids, SSRIs, SNRIs, ACE inhibitors, ARBs, diuretics, lithium, or methotrexate. Eighth, consider labs if available. Kidney function, liver function, hemoglobin, hematocrit, and blood pressure may be relevant depending on the patient. Pop test question. Before giving topical diclofenac, Which allergy history is important? A. Allergy or breathing reaction to aspirin or NSAIDs. B. Allergy to wool socks only. C. Allergy to pollen only. D. Allergy to loud sounds. The correct answer is A. Diclofenac is an NSAID, so aspirin or NSAID allergy or sensitivity is important. Now let's talk about lab monitoring. For topical lidocaine, routine lidocaine blood levels are not usually monitored in everyday nursing care. The nurse monitors the patient clinically. That means we watch for symptoms of toxicity, skin reactions, and correct use. However, if lidocaine toxicity is suspected, emergency evaluation is needed. Treatment is based on symptoms and severity. For topical diclofenac, routine labs may not be needed for every healthy patient using it short-term as directed. But if the patient is high risk or using it longer term, the provider may monitor labs similar to other NSAIDs. Important labs may include BUN, creatinine and eGFR for kidney function, hemoglobin and hematocrit for bleeding, liver enzymes such as AST and ALT if liver risk is present. Platelets and coagulation studies may be relevant if the patient has bleeding risk or is on anticoagulants. Blood pressure should also be monitored because NSAIDs can increase blood pressure or worsen fluid retention. Remember, labs depend on the patient. A young healthy person using topical diclofenac for a short time may not need routine labs. An older adult with kidney disease, heart failure, hypertension, and anticoagulant use needs much closer monitoring. Pop test question. Which lab is especially important for a high-risk patient using diclofenac? A. Creatinine. B. Eye color. C. Hair texture. D. Shoe size. The correct answer is A. Creatinine helps evaluate kidney function, which is important with NSAID use. Now let's talk about administration tips for lidocaine patches. Apply the patch to clean, dry, intact skin. Place it over or near the painful area, depending on the order and product instructions. Do not apply it over open wounds, irritated skin, burns, or infected areas. Use only the number of patches ordered. Do not layer patches. Do not leave the patch on longer than directed. Remove the old patch before applying a new one if the schedule requires it. Fold used patches in half with the sticky sides together before disposal, especially to protect children and pets. Even used patches may contain medication. Wash hands after handling. Avoid contact with eyes. Do not apply heating pads or external heat over the patch. If the patch falls off, follow facility policy or product instructions. For lidocaine creams or gels, apply only the ordered amount and to the ordered area. Do not cover with an occlusive dressing unless ordered. An occlusive dressing seals the area and can increase absorption. Pop test question. What should the nurse do with an old lidocaine patch before applying a new one? A. Remove it if the schedule requires removal. B. Leave all old patches in place. C. Apply new patches on top of old patches. D. Put the old patch in the patient's food tray. The correct answer is A. Old patches should be removed according to the ordered schedule to prevent excessive exposure. Now let's talk about administration tips for diclofenac topical gel or solution. Apply it only to the area directed. Use the correct dose. Some diclofenac gel products come with a dosing card or dosing guide. This helps measure the correct amount. Do not guess. Apply to clean, dry skin. Do not apply to open wounds, infections, rashes, or damaged skin. Do not apply to eyes, mouth, or mucous membranes. Wash hands after applying, unless the hands are the treated area. If the hands are the treated area, follow product directions for when to wash them. Do not cover the area with tight bandages or occlusive dressings unless directed. Do not apply heat to the area. Do not use the medication right before or after bathing unless product instructions allow it. Let the medication dry before covering the area with clothing. Do not combine topical diclofenac with oral NSAIDs unless the provider specifically instructs it. For example, a patient should not use diclofenac gel plus ibuprofen plus naproxen without provider guidance. Combining NSAIDs increases the risk of side effects. Pop test question. Why should a patient avoid using topical diclofenac with oral ibuprofen unless directed by a provider? A. Both are NSAIDs, and combining them can increase side effects. B. Ibuprofen makes diclofenac become an antibiotic. C. Diclofenac prevents ibuprofen absorption completely. D. There is no reason. Combining NSAIDs is always safe. The correct answer is A. Diclofenac and ibuprofen are both NSAIDs, and combining NSAIDs can increase risks. Now let's focus on patient teaching for lidocaine. Teach patients to use lidocaine exactly as directed. Do not apply extra patches or extra cream. Do not use it more often than instructed. Do not apply to broken or irritated skin unless directed by the provider. Do not use heat over the area. Do not cut patches unless the product instructions say it is okay. Some patches can be cut, and others should not be cut, so the patient should follow the specific product instructions. Teach patients to remove patches on schedule. Set a timer if needed. Teach them that numbness can increase injury risk. If the skin is numb, they may not feel heat, cuts, pressure, or irritation as well. Teach them not to scratch or injure the numb area. Teach them to report severe redness, rash, blistering, swelling, or burning. Teach toxicity symptoms. Report dizziness, confusion, ringing in the ears, blurred vision, tremors, twitching, seizures, fainting, slow heartbeat, or irregular heartbeat. Teach safe disposal. Used patches should be folded sticky side together and kept away from children and pets. Pop test question. Which patient statement shows correct lidocaine teaching? A. I should avoid heating pads over my lidocaine patch. B. I can wear as many patches as I want. C. I should leave the patch on for several days. D. I should apply it to broken skin for faster absorption. The correct answer is A. Heat can increase lidocaine absorption and toxicity risk. Now let's focus on patient teaching for diclofenac. Teach patients that diclofenac is an NSAID. Even though it is topical, it still has NSAID risks. Teach them to use only the amount directed. More is not better. Applying extra medication can increase side effects. Teach them not to apply it to broken or irritated skin. Teach them to avoid getting it in the eyes, mouth, or mucous membranes. Teach them to wash hands after applying, unless the hands are being treated. Teach them not to cover the area with tight dressings or apply heat unless directed. Teach them to avoid combining diclofenac with other NSAIDs unless the provider says it is okay. This includes ibuprofen, naproxen, ketorolac, aspirin, and oral diclofenac. Teach them to report signs of GI bleeding. These include black stools, bloody stools, vomiting blood, coffee ground vomit, severe stomach pain, dizziness, or fainting. Teach them to report signs of heart problems. These include chest pain, shortness of breath, sudden weakness on one side, slurred speech, or sudden severe headache. Teach them to report kidney symptoms. These include decreased urination, swelling, sudden weight gain, or unusual fatigue. Teach them to report severe skin reactions. These include blistering, peeling skin, severe rash, or sores. Teach patients to protect treated areas from sunlight if product instructions recommend it. Pop test question. Which patient statement shows correct diclofenac teaching? A. I should report black stools or vomiting blood. B. I can use diclofenac gel with naproxen every day without asking. C. I should apply it to open cuts. D. Topical NSAIDs have no warnings. The correct answer is A. Black stools or vomiting blood may indicate GI bleeding and should be reported. Now let's talk about what findings should be reported to the provider. For lidocaine, report severe skin irritation, rash, blistering, swelling, or signs of allergic reaction. Report signs of lidocaine toxicity. These include dizziness, confusion, nervousness, ringing in the ears, blurred vision, tremors, twitching, seizures, fainting, slow heartbeat, irregular heartbeat, or loss of consciousness. Report if the patient used too many patches, left the patch on too long, applied heat over it, or applied it to broken skin. Report if a child or pet may have been exposed to a patch. For diclofenac, report black tarry stools, bright red blood in stool, vomiting blood, coffee ground emesis, severe stomach pain, dizziness, fainting, or low blood pressure. Report chest pain, shortness of breath, sudden weakness, slurred speech, or symptoms of stroke. Report swelling, sudden weight gain, decreased urination, worsening blood pressure, or signs of kidney problems. Report severe rash, blistering, peeling, or allergic reaction. Report wheezing, facial swelling, or trouble breathing. Report if the patient is taking multiple NSAIDs or anticoagulants and has bleeding symptoms. Report abnormal labs such as rising creatinine, dropping hemoglobin, or elevated liver enzymes if relevant. Pop test question. A patient using topical diclofenac develops chest pain and shortness of breath. What should the nurse do? A. Treat it as urgent and report immediately. B. Tell the patient to apply more gel. C. Ignore it because diclofenac is topical. D. Tell the patient to take ibuprofen too. The correct answer is A. Diclofenac is an NSAID and can be associated with serious cardiovascular events. Now let's walk through a clinical scenario with lidocaine. You are caring for Ms. Parker, a 72-year-old patient with post-herpetic neuralgia after shingles. She has a lidocaine patch ordered for the painful area on her upper back. Before applying the patch, you assess the skin. The skin is intact, dry, and clean. You ask about allergies. She has no lidocaine allergy. You check the medication record and notice a patch was applied yesterday evening but was never documented as removed. What should you do? You should check the patient's skin and locate whether the old patch is still present. If it is still on, remove it according to policy before applying a new one. This is important because leaving patches on too long or applying multiple patches can increase systemic absorption and toxicity risk. After applying the new patch, you document the site, time, and patient response according to facility policy. You also teach the patient not to use a heating pad over the patch. Now let's walk through a clinical scenario with diclofenac. You are caring for Mr. Alvarez, a 68-year-old patient with osteoarthritis in both knees. He has topical diclofenac gel ordered. During your assessment, he says, "I also take ibuprofen every day for my back pain, and I'm on warfarin for atrial fibrillation." What should you think? You should think bleeding risk and duplicate NSAID risk. Diclofenac is an NSAID. Ibuprofen is also an NSAID. Warfarin is an anticoagulant. Using these together may increase bleeding risk. You should assess for bleeding symptoms, review the order, and notify or clarify with the provider or pharmacist according to facility policy. Do not assume topical means no interaction. Here's another scenario. A patient is using topical diclofenac at home and says, "I noticed my stools are black, but I thought that could not be from the gel because it is only on my skin." What should you teach? You should explain that topical diclofenac is still an NSAID and can still carry bleeding warnings. Black stools can be a sign of GI bleeding. The patient should contact the provider promptly or seek urgent care depending on severity and symptoms. Now let's compare these medications one more time. Lidocaine is for numbing. Diclofenac is for inflammation. Lidocaine works by blocking sodium channels in nerves. Diclofenac works by decreasing prostaglandins. Lidocaine concerns include skin irritation and toxicity from too much absorption. Diclofenac concerns include skin irritation and NSAID risks like GI bleeding, kidney injury, cardiovascular events, fluid retention, and bleeding. Both require skin assessment. Both require correct application. Both require patient teaching. Both should be kept away from children and pets. Both should not be used more than directed. Memory tip: topical is targeted, not harmless. Now let's review the nursing school must-know points. Topical pain medications are applied to the skin to treat localized pain. Lidocaine is a local anesthetic. It blocks sodium channels and reduces nerve pain signals. Lidocaine may be used for post-herpetic neuralgia, localized pain, or numbing before procedures. Lidocaine can cause local skin irritation. Too much lidocaine absorption can cause toxicity, including dizziness, confusion, ringing in the ears, blurred vision, tremors, seizures, slow heartbeat, irregular rhythm, or loss of consciousness. Do not apply heat over lidocaine patches. Do not apply to broken or irritated skin unless directed. Remove patches on schedule and check for old patches. Diclofenac is a topical NSAID. It decreases prostaglandins to reduce pain and inflammation. Diclofenac is often used for osteoarthritis joint pain. Diclofenac can cause local skin reactions. Diclofenac still carries NSAID risks, including GI bleeding, cardiovascular events, kidney injury, fluid retention, increased blood pressure, bleeding risk, and serious skin reactions. Do not combine diclofenac with other NSAIDs unless directed. Assess allergies, skin condition, pain location, medication interactions, bleeding risk, kidney function, cardiovascular history, and correct application technique. Teach patients to use only the ordered amount. Avoid heat or occlusive dressings unless directed. Wash hands, avoid eyes and mucous membranes, and report serious symptoms. Memory tip: lidocaine numbs nerves. Diclofenac decreases inflammation. Both need safe skin use. Now let's finish with 5 true or false review questions. Question 1. True or false? Lidocaine is a local anesthetic that helps reduce pain by blocking nerve signals. The correct answer is true. Rationale: lidocaine blocks sodium channels in nerves, which decreases the ability of nerves to send pain signals. Question 2. True or false? Topical diclofenac is an NSAID and can still carry risks such as GI bleeding and cardiovascular events. The correct answer is true. Rationale: diclofenac remains an NSAID even when applied to the skin. Although systemic exposure may be lower than oral NSAIDs, serious NSAID warnings still apply. Question 3. True or false? It is safe to apply a heating pad over a lidocaine patch to make it work faster. The correct answer is false. Rationale: heat can increase lidocaine absorption through the skin and increase the risk of systemic toxicity. Question 4. True or false? Before applying topical pain medication, the nurse should assess the skin for irritation, wounds, rash, or infection. The correct answer is true. Rationale: damaged or irritated skin may absorb more medication and may increase the risk of adverse effects. Many topical medications should be applied only to intact skin unless specifically ordered otherwise. Question 5. True or false? A patient using topical diclofenac should report black tarry stools or vomiting blood. The correct answer is true. Rationale: these may be signs of gastrointestinal bleeding, a serious NSAID-related adverse effect that can occur even with topical diclofenac. And that is your beginner-friendly nursing pharmacology review of topical pain medications, lidocaine and diclofenac. Remember, topical means targeted, but not harmless. Lidocaine numbs nerve signals, but too much absorption can cause toxicity. Diclofenac reduces inflammation, but it is still an NSAID with bleeding, kidney, cardiovascular, and skin reaction risks. As a nurse, your job is to assess the skin, apply the medication correctly, remove patches on schedule, monitor for side effects, teach clearly, and report concerning findings early. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.